Moving on, thank you very much to Dr. Oken. We'll move on to Dr. Hakaim's talk. Dr. Albert Hakaim, he is professor and chair of the Department of Surgery, Mayo Clinic, Florida, and he'll be speaking to us today about management of venous insufficiency. Dr. Hakaim.
Well, good morning. Before I start my talk, I want everybody to stand up next to their chair. And let's have 10 heel raises. Come on now. Okay, your veins, thank you. So today I'm happy to talk about the management of venous insufficiency. I'm going to go over the incidence, the risk factors, the signs and symptoms, which I'm sure a lot of you see on a daily basis, the classification system that we use as well as insurance providers use, which is getting more and more important, the anatomy of the normal venous system in the leg, and then the abnormalities that occur, complications of varicose veins, the treatment of varicose veins, some newer therapies, and then I've included a reference slide that's in your packets, I guess, that goes over all the more recent literature on venous disease. So in terms of incidence, more than 40 million Americans suffer from varicose veins. Almost half of them have a family history of varicose veins. If both parents had varicose veins, your chance of having varicose veins is about 90%. If one of your parents is affected, daughters have a 60% chance, sons have about a 25% chance of developing the disease. The prevalence is greater in women than men, 55% to 45%. About 41% of women over age 50 have varicose veins, and approximately 50% of the population over 50 has varicose veins. Women who are moderately overweight, BMI of 25 to 29, have a 50% increase in developing varicose veins compared to those who are not overweight. And women with a BMI greater than 30 have 3 times the risk of developing varicose veins. So you kind of see the theme of obesity affecting varicose veins. Signs and symptoms, there may be no symptoms at all. They just may be some big veins in the leg, in which case we rarely do anything about them. Other symptoms may be bluish or purplish discoloration of the veins, twisting and bulging of the veins, painful, aching or heaviness in the legs, burning, throbbing, muscle cramping,